so today we're going to be measuring hip AB and AD duction with the goniometer. So for patient position, we have the patient lying supine. The end feel for both AB and AD duction is firm. For AB duction, the normal ranges are from 40 to 55 degrees, but those vary depending on flexibility. So for hip AD duction, normal ranges for that is 20 to 25 degrees, and like I said before, that is also still a firm end feel with all the same landmarks. So for hip abduction, the landmarks are the fulcrum goes to the anterior superior iliac spine of the side being measured, which is the right side. The proximal imaginary line, and the proximal arm is using the imaginary horizontal line extending from one ASIS to the other ASIS. And the distal moving arm is the anterior midline of the femur using the midline of the patella as reference. So we can ask the patient to hold on to the goniometer as I move him along. And I'm going to just passively bring him out, holding on to the iliac crest as far as we go. I just want to make sure that he isn't going to be moving his trunk at all. So I will be moving this. And he has 54 degrees of movement. All right, so for hip adduction, we have to have the patient move the opposite leg a little bit abducted, just so you can get some of that range in there for the adduction. We are using all the same landmarks. The fulcrum is over the ASIS of the side that we're moving. The arm that is the stationary arm is going to be using the horizontal imaginary line to the other ASIS. Then we are using the anterior midline of the femur, using the midline of the patella as the reference. So I'm going to passively bring him in. And that's where he seems to stop. You are. And his normal range is 22 degrees.